Welcome to the Sir Robert Ogden Macmillan Centre at Harrogate Hospital. We give many different types of treatment for cancer here, including chemotherapy, targeted therapies and immunotherapy. These treatments are collectively known as systemic anti-cancer treatments, abbreviated to SACT. The treatment you receive will be dependent on your type of cancer. You will already have had a discussion with your consultant about your diagnosis, the treatment options and possible side effects. This video will provide you with important information on what to expect on the day of your treatment, how it will be given, the possible side effects and what to do if you feel unwell at any time during your course of treatment. We also offer health and wellbeing services to help support you during your treatment. Our Health and Wellbeing Information Manager will contact you to discuss your individual needs and offer any additional support. We are based at the Sir Robert Ogden Macmillan Centre on the site of Harrogate District Hospital. The building is accessible from Williston Crescent, which is just off Lancaster Park Road.
Car parking is free of charge to patients attending the centre. You will need to log your car registration number each day you enter the building on the touch screen at reception. Parking is available in the main hospital car park via Lancaster Park Road. There is a drop-off bay directly in front of the main entrance. However, the maximum waiting time is 20 minutes only.
Whilst you are welcome to drive to your appointments, we would advise you not to on your first visit. Alternatively, we are well connected via public transport.
When preparing for your treatment appointment, it is advisable to wear comfortable clothes and a top or a shirt that is either short-sleeved or has sleeves that can be easily raised above the elbow. You can eat and drink as normal beforehand. In fact, it is important to eat a light breakfast and drink plenty of water before you arrive. Please ensure you take any medications as you would normally, including any pre-medications you may have been asked to take. When you arrive, you'll be checked in at the main reception desk where the reception staff will direct you to the treatment unit. There are wheelchairs available for use should you require them. You'll find the treatment unit directly along the main corridor where a member of our nursing staff will greet you. You may be asked to take a seat in our waiting area. Refreshments will be offered to you during your appointment. We'll provide you with a light lunch of sandwiches, soup and cake. Please inform staff if you have any special dietary requirements. To reduce the risk of infection, we advise that visitors do not accompany you during your treatment. However, exceptional circumstances will be considered. Please discuss this with your nurse in charge when you attend for your treatment. Free Wi-Fi is available to you throughout the building and you are welcome to bring in your mobile phones or tablet to use during your treatment. You are also welcome to bring books and magazines with you, as we are unable to provide these.
You will have been given an appointment for a face-to-face assessment with a nurse prior to starting your treatment. During this appointment, we will check your height, weight, blood pressure and take your bloods, along with any other pre-treatment investigations that may be necessary. Please ensure you've watched this video prior to this appointment, as it's a good opportunity for us to answer any questions you may have. At the pre-assessment appointment, you'll be given a wallet containing some important information. This will include our 24-hour helpline card, including who to contact if you become unwell at home, advice on how to reduce your risk of infection, a guide to our wellbeing and supportive services, preventing blood clot information, blood room opening times, written information about the treatment you'll be receiving, and a free car parking pass. SACT can be given in various ways, including by tablet, injection or via a drip. If you're receiving your treatment via a drip, the nurse will insert a cannula, a short thin tube, into a vein in your hand or forearm. In some circumstances, you may be offered a PICC line, which is a long, thin, hollow, flexible tube inserted into one of the large veins in the upper arm. Your consultant or nurse will discuss this with you if necessary. Systemic anti-cancer treatment is given in cycles. This is a period of treatment followed by a rest period. For instance, you might receive treatment for 1 day in the first week, followed by 2 weeks with no treatment. These 3 weeks make up one cycle. The rest period gives your body a chance to recover and build new healthy cells.
Hello, my name is Jay. I'm a medical oncologist. That's a doctor who specialises in treatment of cancer with medicines. You may be looking at this section because treatment has been recommended for you. This can sometimes be a confusing and worrying time, and understanding a little more may help you to prepare. Our immune system protects the body against illnesses and infections. Immunotherapies are specific treatments that trigger the immune system to find and attack cancer cells. There are different types of immunotherapy, and each one uses the immune system in a slightly different way. Due to their action, immunotherapies create side effects in different ways compared to traditional chemotherapy. For example, the side effects can come on early, but may show themselves many months after treatment has finished. Immunotherapies can cause inflammation in different parts of the body, most commonly the bowel, liver, skin, lungs and hormone-producing organs such as the thyroid gland. We will explain the most common side effects here, and it's important to remember that everyone's experience of treatment is different, and you will not encounter all of these. As immunotherapy uses your own immune system to attack cancer cells, this can also cause inflammation of healthy cells too, which causes the side effects. This can show itself as increased shortness of breath, changes in your vision, behavioural changes, severe persistent headaches and muscle weakness. It's important that you contact the Acute Oncology Helpline immediately if you experience any of the above. Your cancer care team can provide you with advice and medications to help deal with any problems. Most side effects will ease or go away completely after you have finished your course of treatment.
Occasionally, some people will have an allergic reaction whilst receiving their treatment. A reaction is usually mild, but rarely can be more severe. The nurses working on the treatment unit are highly trained to manage these situations should they occur. Always tell your nurse straight away if you feel unwell or you have any of the following symptoms: feeling hot or flushed, shivering, itching, a skin rash, feeling dizzy, a headache, feeling breathless or wheezy, swelling of your face or mouth, pain in your back, abdomen or chest. Sometimes a reaction happens a few hours after treatment. If you develop any signs or feel unwell when you are at home, contact the Acute Oncology 24-hour helpline straight away. If the drug leaks outside the vein, it can damage the surrounding tissue. This is called extravasation. This is uncommon, but if it happens, it is important to treat it quickly. Tell your nurse straight away if you have any stinging, pain, redness or swelling around the site. If you get any of these symptoms after you get home, contact the Acute Oncology 24-hour helpline. Immunotherapy attacks good cells in the body as well as the cancer cells. If the number of white blood cells is low, you are more likely to get an infection. A low white blood cell count is sometimes called neutropenia. Blood cells are likely to be at their lowest 7 to 10 days following chemotherapy. It is important to get any infection treated as soon as possible, so please contact the Acute Oncology Helpline if you experience any of the following symptoms. Your temperature goes over 37.5, you suddenly feel unwell, even with a normal temperature. Your temperature goes below 36, feeling shivery and shaking, a sore throat or mouth, a cough, breathlessness, diarrhoea, needing to pass urine a lot or discomfort when you pass urine. Remember, careful food preparation and avoiding some food types will also help to prevent infection. Please refer to the Reducing Your Risk of Infection booklet for further advice on high and lower risk foods. A number of white blood cells will usually return to normal before your next treatment. You will have a blood test beforehand to check this. If your white blood cell count is low, your consultant may delay your treatment, usually for a week, until your white cell count increases. This is quite common, so don't worry if this happens.
You will receive anti-sickness drugs to help prevent or control sickness during your treatment. We recommend that you take this medication as prescribed to you, as it is easier to prevent sickness than to treat it after it has started. If you feel sick, take small sips of fluid often and eat small amounts regularly. It's important to drink enough fluids. If you continue to feel sick or are sick, contact the Acute Oncology 24-hour helpline as soon as possible. The nurse will give you advice and may change the anti-sickness drug to one that works better for you. It is normal to experience a loss of appetite or taste changes when receiving cancer treatment. If this does not improve after a few days, tell your nurse, who will give you advice. They can also refer you to our Macmillan dietitian if needed.
It is normal for the treatment to affect your bowel habits, and you may experience diarrhoea or constipation. If you have diarrhoea, try the following things. Try to drink at least 2 litres of water each day. Avoid alcohol, caffeine, milk products, high-fat foods and high-fibre foods. If you experience more than 4 episodes in 24 hours, contact the Acute Oncology Helpline as soon as possible to rule out any cause of infection. If you have constipation, try eating high-fibre foods such as fruits, vegetables and wholemeal bread, and take regular, gentle exercise such as going for a short walk. Please speak to your nurse or call the Acute Oncology Helpline if you need any further information.
Treatments can sometimes reduce the number of red blood cells in your blood. Red blood cells carry oxygen around the body. If the number of red blood cells is low, this is called anemia. You may have symptoms such as pale skin, lack of energy, feeling breathless, and feeling dizzy and lightheaded. If you are very anemic, you may need a blood transfusion, which will be discussed if required. The number of platelets in your blood can also be reduced. These cells help the blood to clot and stop bleeding. If the number of platelets is low, you may bruise or bleed easily. You may experience symptoms such as bleeding gums or nosebleeds. Tell your doctor if you have any unexplained bruising or bleeding.
It is very common to experience a feeling of tiredness or exhaustion. You may find it difficult doing simple things such as brushing your hair or getting dressed, concentrating or remembering things, or feeling like you have no energy or strength. It is possible to manage fatigue, and your nurse will be able to advise you on this. It usually gets better after treatment finishes, but it may continue or sometimes afterwards. Everyone experiences it differently. The cause of cancer-related fatigue is not fully understood, but there are many possible causes. The cancer itself, side effects of the treatment, anemia, eating problems, pain, psychological effects of cancer or the treatment.
You may notice some changes to your skin. If your skin feels dry, try using an unperfumed moisturising cream every day. If you develop a rash, contact the Acute Oncology Helpline. During treatment and for several months afterwards, you will be more sensitive to the sun. Your skin may burn more easily than usual. You can still go out in the sun, but always use a high sun protection factor, or SPF, of at least 30, and cover up with clothing and a hat. Any changes to your skin are usually temporary and improve when treatment finishes. During your treatment, you are at an increased risk of developing raised blood sugar levels and diabetes. Your blood glucose level will be monitored regularly. Please let your nurse know if you are experiencing increased thirst, feeling tired and passing urine more frequently. If you already have diabetes, your blood sugar levels may be higher than usual. You'll be asked to monitor your blood sugars regularly at home, as the dose of your insulin or diabetes tablets may need adjusting.
Cancer and some cancer treatments can increase the risk of a blood clot. Symptoms of a blood clot include throbbing pain, redness or swelling in a leg or arm, suddenly feeling breathless or coughing, sharp chest pain which may be worse when you cough or take a deep breath. If you have any of these symptoms, contact the Acute Oncology 24-hour helpline immediately or go straight to accident and emergency, especially if you have chest pain. A blood clot is serious, but it can be treated with drugs that thin the blood. These are called anticoagulants. Your doctor or nurse can give you more information. You can help reduce the risk of developing a blood clot by staying active during treatment, drinking plenty of fluids, especially water. You may be given anticoagulants to help prevent a clot.
It's strongly advised that you don't get pregnant when you are receiving cancer treatment, as this can harm the developing baby. If you are sexually active, please ensure that you use a barrier method of contraception during your treatment and for up to 3 days afterwards. Some cancer drugs may affect your fertility now or in the future. Please speak to your consultant or cancer nurse specialist if you would like to discuss this further. If you think you need any dental treatment, please talk to your consultant or cancer nurse, as there is an increased risk of infection.